Hello, my name is Esther Park, and I'd like to present to you the feasibility study for Lifestyle Community Clinic. Approximately 51 million people in the United States do not have health insurance. This number will certainly increase given the rising unemployment rate, increasing disparity between the middle class and those below the poverty level, and rising discrepancy of health care that is impacted by wealth. Focusing locally, there are approximately 40,000 uninsured people within the city of Tacoma and about 1 million in the state of Washington. Lifestyle Community Clinic, or LCC, is a grassroots movement of a group of young healthcare professionals who desire to provide quality medical care to the uninsured at an affordable cost. LCC will offer non-emergent acute care and preventive care to improve the well-being of the uninsured population. The clinic will offer preventive and interventional medical care to decrease the cost of chronic diseases by 2% each year. It will also offer cancer screening with the goal to decrease cancer-related mortality by 50%. The clinic will screen for chronic conditions such as diabetes and hypertension to reduce mortality from acute heart attacks by tenfold and overall heart attack-related mortality by 15 to 40%. Through workshops and seminars, the clinic will offer nutritional and exercise counseling to reduce the rate of obesity that is plaguing 30% of Americans. The decrease is expected at 1% per year. The clinic will also offer smoking cessation programs for the 20% of Americans who smoke. LCC will also offer preventive health education and seminars with the goal to improve participants' overall health and subsequent earnings by 10 to 30%. The clinic will offer a cost savings of medical care totaled at 80 to 90% below traditional cost. LCC also benefits the sponsoring hospitals by decreasing the rate of emergency department visits by the uninsured, which is currently at 20% of the total visits. Based on market research, about 10% of the clinic visits would have utilized the emergency department if the clinic were not available. Currently, there are 3 free clinics in the Tacoma area: the Neighborhood Clinic, RhodaCare Clinic, and Trinity Clinic. 2 of these clinics use the basements of local churches to see patients, and 1 uses an annex building at a local university. All of these clinics are running at full capacity, and the clinic directors have no plans to expand the clinic hours, staff, or space. LCC will be an addition to the overburdened system in providing quality care to the uninsured of this region. LCC hopes to build strong relationships with its customers through direct provider-patient interface and group activities. The demographics of LCC customers will most likely reside in urban Lakewood, have some degree of income, whether from sporadic work or disability, is about 40 years of age with a range from teens to 64 years, most likely own a television, have internet access, have means for private transportation, have minimal access to dental and medical care, are recipients of food stamps, rent their places of residence, has had some high school or college education, and have a medical condition that requires ongoing treatment and surveillance. The main avenue for marketing for the existing clinics is through word of mouth and internet websites. LCC will create a website to inform potential customers of LCC services. LCC also plans on using ethnic radio and newspaper channels as well as billboards to advertise to ethnic minority groups who are uninsured. Community centers are also a low-cost channel to distribute service information. LCC will play an integral role as one of the drivers of the healthcare industry by balancing quality health and cost effectiveness, which are key success factors for this industry. By collaborating with other key resources and partners such as the local hospitals, the distributors of medication and medical supplies, LCC hopes to build a long-lasting, mutually beneficial relationship with all partners involved. Barriers that LCC may have to overcome include raising capital to purchase the medical equipment which are not already donated and in storage. Negotiation with laboratory and radiologic services are already completed. Office space is also available. The professionals who started this grassroots movement are all dedicated healthcare providers, but there will be a need to recruit more as the clinic usage increases. Alternates to MD providers include resident and fellows in training, and mid-level providers such as ARNPs and physician assistants who may have similar passion in serving this need. Currently thus far, staff volunteers include 3 nurses, 2 office assistants, 3 attorneys, 1 accountant, 1 medical director, 1 clinic manager, and 1 interpreter. The nominal patient visit fees, as well as medication costs which are collected at the time of service, and various donations from religious and private organizations as well as from individual donors will keep LCC self-sustaining. This is important in the current volatile economy. Many free clinic directors experience a certain degree of anxiety from not knowing whether there will be enough grants to continue the program in the following fiscal year. For LCC, a minimum of 120 patients per month or 30 per week is needed to remain solvent. As a 501c3 nonprofit organization, LCC is able to provide tax-exempt receipts for these donations. LCC can also donate to other charitable programs as well as use the excess revenue, if available, for internal improvement and expansion of clinic programs. Based on the cost analysis, the patient visit fees at LCC need to be at least $10 per visit. This is a reasonable expectation since the market segment is willing to pay somewhere between $5 and $30 per visit. Most are also willing to pay for laboratory and radiologic studies. However, LCC has already received commitment from the local hospitals to supply these services free of charge to LCC patients. If LCC starts with 40 patients the first month and increases its patient volume by 10 per month with a maximum number of 120 per month, the break-even point would occur in the 8th month of operation. And funds which come in will expand the types of services that can be offered to the patients. With an overhead cost of less than 10%, a steady stream of patients, strong support from local healthcare partners and suppliers, healthy relationships with its customers, and dedicated group of staff and providers, LCC is certain to fulfill its mission in providing affordable, quality health care to those in critical need. Truly, LCC is all about serving people and building relationships that change people's lives for the better. The following references have been used to prepare for this presentation. Thank you.